if you don't mind. I started the recording. Thank you so much, Anna. Um, Hi, everybody. So great to see so many familiar faces and new faces here. Welcome to this joint Lunch and Learn. That is a collaboration between Health and Medicine's Youth Pathways Committee and Rapid, Illinois, based out of the UIC School of Public Health. We invite you all to join this community of practice where we will engage in dialogue around helping young men of color thrive throughout the health career pathway. First, I want to offer up some group agreements for all of us. You might notice this is just an open Zoom meeting, so I do ask our audience to please stay on mute until the formal Q&A that will be about the last 20 minutes of the session. Respectfully, I do want to ask the audience to please refrain from any sales pitches or overly promotional materials when we get to that open session. And then lastly, as always, I want to lead with humility, curiosity, openness, and understanding. We have a really great panel here, and so I really want us to all commit ourselves to understanding what they have to say on a deep level. I want to start with why this, why now, and I'll paraphrase a source that I found. In 2023, the Federation of Associations of Schools of Health Professions declared the low number of historically underrepresented men of color graduating and entering the healthcare professions a national crisis. When you look at health professions, different sectors, different disciplines within the health sector, in 2019, only 6.6% of all dental school applicants were historically underrepresented men. In medicine, the Association of American Medical Colleges reported that between 1978 and 2014, the number of Black men applying to medical schools actually dropped. Additionally, the number of Black men that matriculated into medical schools dropped as well. And that is despite an increase of Black men graduating college. Similarly, in the field of optometry, historically underrepresented students make up less than 9% of the optometry graduates and less than 5% of practicing optometrists. In pharmacy, practicing pharmacists from historically underrepresented backgrounds account for less than 12% of the pharmacy workforce. Looking at more specific labor data in Chicago and Cook County, a report that was released by the Chicago Cook Workforce Partnership had, on the national scale, in all of the United States, the labor force participation rate for Black men stood at 63.5%, which was the lowest among all worker classifications. That's in the United States. In Illinois, Black men participation in the labor force is even lower. It's 53.1%. Additionally, in the city of Chicago, 55.2% of Black men aged 20 to 24 were disconnected from work, and that's 11 points higher than the national average. This is reflective of long-standing systemic barriers that continue to limit economic opportunity, job stability, and wealth building for Black men. Looking at this data, it's really easy to, of course, see this as a problem or as a crisis, as earlier mentioned, and that's certainly one piece of this. But I do want to offer up a more strengths-based approach. And I want us to come together, group our strengths, and work to imagine how things could be different than what is going on, and that's why we're here. So seeing everybody here gives me a lot of hope, and I'm hopeful that we can collaborate and continue to build equity in our health workforce. This is Health and Medicine's mission. It's what brings the Youth Pathways Committee together, and we're committed to bringing together the right people. On that note, I want to pass it off to one of our close collaborators from the Rapid Illinois team, Johari Taylor, to talk to you about another intermediary convener, Rapid Illinois. Johari, why don't you take a couple minutes and then introduce our moderator?
Thank you, Matt. Hello, everyone. My name is Johari Taylor. Just as Matt said, I am the program manager with the Rapid Project, which is the resources and programs for increasing diversity in health professions. Basically, what Rapid is that we have two kind of resources, but we have a lot of aims The current work to date is really building and publicizing a more robust and comprehensive inventory of health career programs in Illinois, and then also cultivating community of practices and then sharing promising practices as well. Also networking with leaders, stakeholders, and also a more broader approach. The Rapid Illinois inventory is an online inventory that is comprehensive of about over 110 programs in Illinois. Any health profession that is identified, such as pharmacy, public health, social work, psychology, things like that, those are all in our program with the aim of really increasing diversity in the workforce up from elementary to post-grad. And I would drop some flyers in the chat as well so everybody can see. But many of you have probably gotten some emails from me, but I am the face behind those emails for contacting you all. So nice to see you all if we haven't met already. We work with Dr. David Dubois and Michelle Hathaway on the project as well since 2021. So it's really nice seeing everyone and coming together for this Lunch and Learn. And then I will pass it off to our moderator, which is Levi Moore. Take it away.
Joe, appreciate it. Thanks everyone for tuning in this afternoon. My name once again is Levi Moore, and I work for the Hektoen Institute, which is an 80-year-old public health not-for-profit in Chicago. Part of my duties is I help coordinate the activities of a coalition of 15 public health care organizations called the Foxglove Alliance, and one of our initiatives is the M3R campaign, More Minorities in Medical Research, and a big part of that is to try to get more Black and brown youth in Chicago to enter into careers in Chicago. So when Matt mentioned, said, would I be interested in being the moderator for this, I jumped on it. So now you know who I am, and we're going to meet our panel. So let's start with Dr. Shuck.
Thank you, Levi. Good afternoon, everyone. I'm happy to be here. My name is Dr. Johari Shuck, and I serve as the executive director of Sneakers to Scrubs, which is a newer organization in the medical preparation ecosystem in Chicago. I also serve as the program director for MedKeep, which is based out of University of Chicago, founded by Dr. Abdullah Pratt. And I also serve on the Illinois Working Group for Black Men in Medicine through the American Association of Medical Colleges. So very much looking forward to this conversation today.
Okay, thank you. Let's go to Josh.
Hello, everyone. My name is Josh. I'm in my second year at UIC, and I'm part of Sneakers to Scrub. And yeah.
Okay. Kris.
Good afternoon. My name is Kris Johnson, Assistant Director of Radiology here at University of Chicago. Where, amongst other things, my primary responsibilities are also host internship opportunities focused on young adults with expressed interest in X-ray tech careers in hopes that we can create pipelines to opportunities. And I'd be remiss if I didn't share outside of work, executive director for a nonprofit intentionally focused on underserved youth and creating opportunities to address nonviolence and crisis recovery.
Okay, thank you. And last but certainly not least, Dawud.
Good afternoon, everyone. My name is Dawud Salako. I am a rising senior at Providence St. Mel. I am an ambassador for Sneakers to Scrubs, just like Josh. I'm also a part of the Youth Advisory Council, and my free time, I like to play basketball. Really excited to be here.
Great. I'm glad you're here. Let's see. I'm going to try to. Hold on. Can you see my screen? Is a photo? Anyone?
No.
No.
No?
Try it now. Try it now, Levi. I just made you the co-host.
Oh, okay. Got it?
No.
No. There.
That's it.
Okay. There's a big reason why I'm showing this photo. This is a great thing that happened in July of 2023. This is the first cohort of the Malcolm X College Medical Assisting Pathway Program. And I knew about it because I do a lot of work with Westside United, which was also involved. Now imagine 162 people, young people, being able to start careers in healthcare. And this picture just shows 90 of them. And the more I saw it, I looked at it, I thought, well, you know what, this is really great. Imagine a lot of these young people are, from the West Side, grew up on the West Side, and they'll be able to work at institutions on the West Side and, serve their neighbors, the people they grew up with. And then something was just sort of, I don't know, it was sort of eating at me. So, man, there are 90 in this photo, and I counted. There are 6 males in this group. And that was when, that very moment is when, I became, really interested in this topic because one of the things that Fox Club tries to do is that we try to utilize our members to fix problems or parlay opportunities. And this is really an opportunity that young women of color are definitely taking advantage of. But the reason why we're here today is to figure out, okay, how can we get young men of color to see this opportunity, because it's just, as all of you know, workforce availability in healthcare is a huge problem. And it's kind of people in my generation's fault. I'm one of the last of the baby boomers. And every day in America, 10,000 people are turning 65. And what do? They retire. And that's why there's a shortage of cops and L drivers and hotel workers. There's even a shortage of people working in the insurance industry. And healthcare is even worse because of the pandemic. And it just, it just burned a lot of people out. So what are they doing? They're going to have to recruit from areas that they've never recruited from, which is a great opportunity. So I want to sort of lead off with, that was sort of like my story of, why I'm here, why I'm trying to help. But anybody on the panel would like, if you'd like to share, what kind of sparked you?
I'll start, since I obviously stand out. I'm not a Black man and I'm not in medicine. And so people always ask me what brings me to this work. What I can do is to the experience of undergraduate students that leak out of the pipeline, medical doctor, and because of path. And so I think that the conversation from my perspective is important, and I'm here because my background is higher education. I care about the entire pipeline, and so really trying to figure out what are the leaks from kindergarten on up, because that's really where it starts.
Thank you. Anybody else want to chime in?
I thrive in audiences like this. So this being my first time on this panel, I'm actually an alumni from Malcolm X, so I graduated from there.
Oh, great. Yeah.
And so like the goosebumps are jumping off the page, because I recognize that a lot of us would not know if not for the chance experiences that we ran into. So my mother being a single Black parent, financial aid advisor at Malcolm X College, and by chance, when I was 15 years old, I had an opportunity to engage into a summer program. And in that summer program, I learned that these people pushed the button, and after 2 years of going to school, they landed into career opportunities that otherwise provided things that I probably didn't see a whole lot coming up.
Mm-hmm.
And so for me, it was a personal piece. I had no idea that right after high school, I'll go into the military and 9/11 would happen. And I made a covenant with myself at that time, being in basic training, that if I ever survived the experience, that I would go back to connect and create opportunities for others. So thank you for however I landed in this conversation, because I welcome, while we may not, let's say, land on all the perfect solutions, just being a part of the conversation is a blessing.
Okay. Kris, Dawud, if you want. Thank you, but Josh, Dawud, if you want to chime in. If not, I can go to another question. Okay. Well, I'm definitely going to sort of pick on you two guys for this question. And anybody, Dr. Shuck, Kris, you can play, but really curious as to what Josh and Dawud think. What are young minority men's opinions of or perceptions of going into a healthcare career? Your contemporaries. How do they see it?
I'll let you go first, Josh.
You go ahead. You can go ahead.
Personally, I would think that the medical career is, I feel like obviously is like a really, really tough career to get into, a tough path. And personally, having mentors and people that you look up to, I feel is really, really important. And it's what makes the medical field appealing for young Black men. I feel like there's a lot of influences in our lives, and we're looking up to so many people. And having a mentor, someone who you can, see yourself in, who you can kind of see like later down the line, oh, this is the person that I want to like be like. That's super, super important. And I feel like that's what makes the medical field appealing. So in terms of importance, I would say having a mentor that you can, put yourself in their shoes is definitely key.
Thanks. Josh.
Like what he was saying, having a mentor it would be great because like a lot of people, I'm from the South Side, and a lot of people really like they don't talk about being in the medical health field. All they want to talk about is being sports and stuff like that. And I feel like the more you have a mentor, the more it kind of push you to go in the field of medicine, no matter if it's athletic training or being a nurse or dermatologist or whatever. Just keep pushing you to be in that field.
Well, you know what? You're from the South Side. I'm from East St. Louis. I'm a little bit older than you, but that has not probably hasn't changed in years. That perception. Kris, Dr. Shuck, any insights on this?
Definitely value added and identifying those that exist in the space that you like to get to. I always felt like one of my favorite phrases is, can we have time for coffee? Because I feel like a lot of what I've been able to do professionally is just a combination of bits and pieces that I've picked off of individuals that I've met throughout my professional experience.
But I know, like with youth pathways, one of the things we've talked about is just that a lot of youth, especially if you're not, middle class parents, aren't from, have never heard of these careers, so you don't even know where to start or what they entail. But Matt provided a very good kind of overview, and I want to leave with Dr. Shuck on this. Is there data or known research studies that target why men and then minority young men don't choose healthcare as their career choice?
I mean, this has been studied for decades, right? And so I think we come up with similar answers. And, I'll go back again to the academic preparation. I mean, students are, especially in CPS, that I can speak to directly, less than 17% of eighth graders pass algebra. That's not just an indicator of, what training that they're getting, but that affects high school graduation and all these other careers. So I think by starting there, that's really where students start to formulate their employment aspirations, and data talks about that. Data also talks about how at young ages our Black males are more influenced by sports and entertainers because that's what they see as their way out of whatever their circumstances are. So to the point that Kris and Josh and Dawud have made, we need Black men in front of them, but the conundrum is that there's not many of Black men in the healthcare career. So it's kind of, we have to figure out those ways to kind of mitigate that. And I think that by talking about different pathways to medicine, not just focusing on being a doctor, because that is a hard sell, right? And so I think that, the data that's out there really talks about, academic, social barriers that are embedded in this overall, systemic problems that have been encountered in this issue since 1910, to be honest. So this issue is not just a 2025 problem, it's an 115-year issue. And so, again, there's been a lot of data, but I think this is the time, we talk about collaboration and things like that. Data also says that we need collaboration in order to help provide these opportunities for young people. And that's the struggle. Students don't always know where to go. And so we need organizations like Sneakers to Scrubs, CPAS, MedKeep, all of these to curate these experiences where students can meet folks that look like them to give them that inspiration.
Hey, what? Can I digress or veer off a little bit because I'm starting to see a little theme popping up. Can somebody talk more about Sneakers to Scrubs, because it's sort of like what has been sort of a miscue of you can either be an athlete or you can do this, but Sneakers to Scrubs is actually like taking advantage of that.
Yeah, absolutely. And that was the premise of the founding of Sneakers to Scrubs. Sneakers to Scrubs was founded by 4 student athletes that played college sports at the highest level at Ivy League institutions, but they had peers who were not, academically focused, and they saw what happened to those peers as a result. So serendipity, or whomever you believe in, brought them together here in Chicago for that common goal. And so exactly like you said, Levi, they presented this opportunity to show that you can be an excellent athlete and an excellent student. And really those things feed off of each other, right? Because you need good grades in order to play, or else you can't play, and vice versa. And so that was really the premise of Sneakers to Scrubs, to find an innovative way to connect with young people that see only sports as their way out.
Yeah, it reminded me last season when the Bears were on Hard Knocks, there was a running back, and there was this weird problem. He also got into med school, and they almost think that led to him getting cut. Because he's not going to be able to, do both of those, and where's his heart and everything. But hey, on this topic, anybody want to pine in, Kris, or else I'll jump to something else.
No, I just, you were asking about data. I think in my time in St. Louis, I was just looking up the article. Missouri Foundation for Health came out with a white paper. I think it's called "For the Sake of All," and it just kind of drew that connection between socioeconomic impact, health, and education, and how disparities kind of start in the beginning. I thought it was a great read, and just kind of helping us understand kind of how some situations land where they land. I can't call any of the data off the top of my head, but I think it's a great conversation starter in spaces like this.
Okay. This is definitely targeted initially more to Dawud and Josh. Okay, where did you, or how do you get information about careers, and how do you friends? Just out of curiosity.
Well, my mother's a nurse, so she got me hooked with the Sneakers to Scrubs, meeting Marcus and Jamil, because at first I really didn't know what I wanted to do after high school, and then I just met Jamil and Marcus, and they helped me realize I wanted to be an athletic trainer for NBA players or just a sports organization. So, yeah.
Okay, so it was your mom, then you met a couple of role models, and then they
Yeah.
kind of took you under the wing, and then cool. Dawud,
Yeah, so I kind of had like a similar experience to Josh, having like family members in the healthcare field. And then obviously having Jamil and Marcus as role models, getting into sneakers to scrubs, also being able to participate in MedKeep. And then it's almost like once you're in these circles, you just keep on getting pushed deeper and deeper and deeper and just having, your network expanded. So
all right,
from MedKeep initially, thankfully like my network has expanded, so like now I know a lot of other med students who are 4 years down the line and things like that. So yeah, so that's definitely how I get my info and my what I need to know on the steps to a health.
okay. Well, it sounds like folks on the committee in this on this lunch and learn, we got some mentoring to do. It seems like a big key to it. Um, let's go. This is to Kris, and you probably deal with this a lot since you're doing a recruitment aspect. What are some of the barriers men of color face in entering and staying in the healthcare fields, and how can they overcome? Because I've heard a lot of stories about, okay, they started and then some stuff started to happen and they didn't finish.
I think in terms of barriers, it's just recognizing not an old man, but an older person. It's sometimes how do we challenge young people not to always look for the easy button, um, recognizing that the challenge is really mapping the task. And so through some of my internship opportunities, I try to get them to start with establishing the vision, and understanding the barriers, because a lot of times we talk about just going to school, but we don't think about the practical process. Where do I go to apply? Do I even understand what financial aid is and responsibilities of that sort? I've met a lot of young folks that try to approach school assuming that their phone is the best piece of technology that they can, bridge. And so
Mhm.
sometimes there's those technical gaps that if not for someone telling them that there's a better way, they otherwise don't know. Um, and so just and even listen to the other young man speaking, we're fortunate by circumstance that someone happens to, live in our space. But I often
Yeah.
think about that audience that didn't have the example. There's some things that my 7-year-olds are going to get just by virtue of being at the dinner table, listening to me and my wife talk. But I also think that part of the solution is how do we tap into the ways in which young people consume information? Because a lot of times it's the older generation looking back saying, here's how I help you,
That
but
that is really tricky.
but do we really think about TikTok,
Mhm.
Snapchat, and different things like that? Because today we consume information 30 seconds to 2 minutes at a time. And how do we market in those spaces to make up the gap for those that don't have the living room exposure, if that makes sense?
Okay, got it, got it. Some of us are lucky to have someone who can kind of walk us through it, but what if you don't? Dr. Shuck, any insights?
Well, I just wanted to kind of elevate the role of grassroots nonprofit organizations in this work, right? Because where Sneakers to Scrubs is a very small part of it. There's organizations like I Am Able, CPAS, MedKeep that have been doing this work for quite some time. And frankly, this is where the students are getting this exposure. They're not getting it in the schools. So I think that it's important to kind of help those organizations with their capacity, because funding is always an issue, capacity is always an issue. We're always wearing 100 hats while we're trying to do this work of supporting young people. So I think, going back to collaboration, we need to all get together so that people that can support know, number one, what organizations are out there to support. And I would also like to elevate Rapid, the work that they're doing to do that, under the guys, not guys, but under the direction or CPAS really started that initiative to really make sure that these organizations are connected so that we can help give students a pathway to go from one to the next so that they don't get lost in the pipeline.
Yeah. And you just, well, not to pound back, but you just mentioned one of my favorite FOSS Club members, I Am Able. I think what the work they do is phenomenal. Sounds like a big thing from what Dr. Shuck just said too is that there are organizations out there, and that somehow we need to figure out a way to help them get even higher visibility, to be more well known. Which is Matt put that in the chat, some stuff to do.
Sorry, Bill. I'm listening. You should join.
Who's someone? We're picking up your microphone. Davia Doss, I think. No, it may not be you, but someone was talking over. Anyway, this is more for probably Dr. Shuck, Dr. Kris, but then Josh and Dawud might have a pretty good insight. What are the recruitment strategies currently used for your say, pipeline programs, things of that nature?
At least currently, what we're doing in the Department of Radiology, we've done a few things intentionally. One, supporting events like this, where we do career day conversations to kind of talk about the field. Two, 4 years ago, coming to the role, we probably had 50 some odd open technologist roles. To help us kind of cut that in half, we've opened up more tech assistant roles. And all the roles are defined as tech assistants. The real sweet science behind it is by getting folks kind of closer to the department to see what the work is. We don't necessarily call it mentorship, but they get a chance to kind of engage and interact with frontline staff. In addition to that, over the last 4 years, I've led a grant-funded initiative, job shadowing project, where each week young adults get to sit in a different area of radiology. And once a week, we sit down and have some intentional conversations that might invite different program leaders from programs throughout the city. Because in my walk, I'm often meeting people on the margins, recognizing that the school, one of my interns this year graduated from Crane not too long ago. And we kind of talked through what life is like that first year out of high school and not really knowing what they want to do. So in a lot of different ways, we've tried to find opportunities of bringing people closer. And like most other hospitals, we're dangling sign-on opportunities in front of a lot of our job roles in hopes that cash helps make up the difference for those who may otherwise see the cost of going to school as a barrier to get started.
Dr. Shuck, any insight on this?
Sure. So I'll just talk about recruitment into our programs. So the work that Sneakers to Scrubs and MedKeep does is in the schools. So we do in-school programming, and I'll speak right now about MedKeep because, the goal is to expose students to healthcare careers, but the entryway that MedKeep uses is to talk about healthcare disparities, to talk about emergency preparedness skills so that students are seeing themselves learning how to stop the bleed or learning how to do CPR. And they're learning about why it's so important that there are Black folks that enter into the healthcare careers. And so that's where we start. But, the tricky part is getting to the schools because, you have different people that have, they have a lot going on anyway. And so, that's the tricky part. But once you're there and you have like that captive audience, that's a good way to kind of at least introduce concepts of medicine and of these healthcare career opportunities.
Okay, I'm going to flip this a little bit. Josh and/or Dawud, if you were Kris, what would you do to help recruit people into these programs or into schools or whatever? just because we know what we're doing like from you.
Definitely.
I would say like have more basketball camps, but also show like the medical side. I remember the event Sneakers to Scrubs did was it was for this guy who had passed away from cardiac arrest, and so they have basketball camps and also get tested for like see if there's something wrong with your heart, and also have like a game where you can watch other players play basketball. So I would say basically like look for more, basically have like fun activities for the kids to do, but also show them the medical side of the workspace.
Yeah, definitely. I would say that more programs where we can kind of like invite people to programs like that. Also, like as Dr. Chris mentioned, like the power of social media, like nowadays, pushing pushing programs through social media, showing like what we're up to, what programs we have, what examples of the products, students who went through the program, where they're at once they finished. I feel like that's really really important. But yeah, definitely programs where I can call up my guys and say, oh yeah, this Saturday we're going to Sneakers to Scrub program at U Chicago. We're going to the Medkeep program. So definitely.
Okay. Hopefully, I think we may pick up on this one question about what organizations are doing well and what are some new initiatives being tried. But since we're going to go into the open Q&A section a little bit more, this will be for boy, it'll be hard for Dawud because you're pretty young, but for Josh and Kris, what advice would you give to your younger self in terms of career path if you could do it again?
Um,
You want to go first?
no, you go.
Um, what I tell my younger self is not to always just think about sports, and also, um, what would I tell my younger self? Yeah, I would tell myself not to always just rely on sports, and also learn more things. I would tell myself to be more vocal with people and not just rely on sports.
Cool. Kris.
I think as simple as I can put, to understand that the struggle is a part of the learning process. I think sometimes we live and we try to avoid difficulty or procrastinate and put that paper off, not understanding that sometimes the struggle points are where we build character. And I can probably tolerate a lot more at this stage of my career because I've kind of been tested through the fire, if that
Yeah.
makes sense.
You know what? I want to say, Dawud, do you want to weigh in on this?
Yeah, I would probably just say
Yeah.
even if you don't know what to do, I feel like still prioritizing grades and making sure you're doing well in school is important because depending on what you want to do, like that, you're not limited by that by that if you then decide that you want to go into something that requires, that's a bit competitive. So definitely prioritizing grades, especially no matter how young you are or like what grade you're in.
If I had your insight when I was your age, I would be dangerous right now. Well, that's what. Let's open it up to Q&A. And Matt, I'm not sure how you want to handle this, but folks in the audience, let's go.
Can I chime in?
Sure.
Hi.
Number one, who are you? And
Yes, of course. So I am Dr. OK Enya. I was invited to this meeting by Matt. I met with Matt yesterday or earlier this week to discuss my background. So by way of background, it is in medicine, public health, health policy, politics, research, and teaching. I'm a former House and Senate staffer on Capitol Hill. I live in D.C., but I grew up on the south side of Chicago. I lived in Bronzeville. I went to Chi State for my master's in public health. I moved from Chicago to Maryland in 2014 for work and for school. I have a doctorate as well in health policy from the George Washington University School of Public Health. I got my doctorate last year, and my research was a culmination of my lived experience as a Black male growing up on the South Side of Chicago, and going through high school, college, grad school, med school, Capitol Hill, and then into my doctoral program. While I was in Chicago, I was part of what it was then called the Minority Medical Education Program at the University of Chicago, Northwestern, Rush, and I think there was one other school that was involved. And I recall, and I thought I saw Cynthia Boyd on this Zoom. If that's Cynthia from Rush, then it's good to see you. So I say, no, it's not.
It is, and it's good to see you too. Good to see your trajectory.
Thank you. I say all of that to say that I am what does the policy conversation look like? What is the upstream, like the brilliance and the expertise on this call? And I'm going to challenge this audience to shift gears into what does this look like or sound like from a policy perspective? How do we help shape policy and practice at the local, state, and federal levels? Because we can have this conversation, like, we know the data, both the quantitative and the qualitative data. I'm a living example of a pipeline success as a mentor, as a coach, right? And so I want to make sure that we are taking a deeper dive into the ways in which we can help shape policy, because in fact, I'm writing my second book. It's called the John Henry Health Equity Playbook. It's a 4-year health policy agenda for Black men. I'm looking to launch it this fall here in the DMV as I get ready for a nationwide book tour. And it contains much, if not all, of what we are discussing literally today. And so that is my way of trying to give back and to serve as a resource and to push us to think about the upstream, the policy, because as a former staffer on Capitol Hill, I have usually been one of a few conscious Black men in the room when we are literally drafting policy. If we are not at the table, we are on the menu. I say it all the time. If we are not at the table, we are on the and so the question then becomes, how do we get to the table as conscious Black and brown people, as Black men? And so I just needed to get that out. Now, I'll also know, as I said earlier, I worked at Malcolm X College for 3 years, helping to run their physician assistant program. I also had to recruit students, right? And so I get it. I just want to kind of share that so that people can see a living example of what success can look like despite the odds. Thank you.
Great. And you know what you touched on? I'm definitely more of a policy person, and the way things look, it kind of goes back to the start of this Lunch and Learn. There's a problem, there's an opportunity. We don't have enough people in the workforce. Too many folks near my age retired, and we're going to keep retiring over the next 3 years. And there isn't a machine where you can automatically spit out 22, 23-year-olds ready to enter a workforce. They're going to have to recruit from areas that, let's say, traditionally have not been mined. So that's one thing. Anybody else Q&A, just jump in or whatever.
I just wanted to respond to the good doctor, India. I've been thinking about this a lot lately, and I think that going back to the math piece of it, because there's so many students that are eliminated from the pipeline from the very beginning. And so I know that there are states, and I just started doing this research, so I can't, point out specific examples off the top of my head, but there are states that have implemented policy around math proficiency, where students, if they don't reach a certain benchmark, they have to be put into some sort of enrichment, tutoring, whatever it is, to get them to that next level. So for me, like I said, I've been thinking about this a lot lately, and I think it starts with math, because that opens the door to other high-paying careers, not just medicine, right? So that's my 2 cents.
Okay. Anybody else out there with a question? Or wants to make a statement about anything?
I have a quick one just to build off of what Dr. Enya was saying. I really appreciate the public policy perspective that you brought in here, Dr. Enya. I'm curious to hear from Kris, more so from a private policy perspective. You talked about how you shifted your openings in the radiology department by allowing for more entry-level roles. I'm wondering if you could say a little bit more about what that was like as far as sort of getting the institution behind your idea, because I think that's a great idea. And I think that a lot of us here convene employers, and we have a task to say, how can we, drive systems change within those employers? And so can you talk a little bit about what that sell was? Was it difficult? Did you have to cut through bureaucracy and so on?
All of the above. Thank you. Because I'm gonna steal the statement you just made. So I'm an MBA by background, and one of the things I recognize is that if I could be candid in this space, sometimes the members of the C-suite aren't a reflection of those that are working in the front lines. And there's this, and we all speak English, but sometimes there's an experience gap, there. And so part of my strategy was like, look, I can do the math. 50 technologist jobs at about $75,000 per hour is a number. And I was like, and these positions are sitting on the rolls, not being used. And part of my concern is that how long can we go demonstrating that we can get it done absent the positions that we have? Because what we were saying is that while we were shorthanded, we would have been even more shorthanded due to the burnout because we were stretched thin. Quality errors were piling up, different things like that. So part of that, part of my assessment was kind of doing that ROI, speaking the business speak, and really getting leadership to kind of understand, here's the cost of doing nothing. Because sometimes you have to, in business, you have to really be able to keep in mind, like healthcare is still about the bottom line. Take that for, what it's worth. But when healthcare is expanding, so 20 years ago when I got into the field, everybody came to the big hospital, but now with the advent of urgent cares and small satellite facilities, we're spreading out. And because of that, folks that work in the field have choice, right? This is the first time in my career where it's been a true employee market, meaning, they shop around to different things like that. So getting leadership to understand the financial impact. And I would encourage to any community organization looking to kind of break in, show us how it helps us save money or make money. Because as the new cancer pavilion is going up in the next 2 years, just like anybody looking to buy a new house, what do you do first before you make that investment? You save, right?
Yeah.
And so being able to show them ways in which we can save or otherwise not increase our waste was part of the sale, because just trying to sell the sad story about being a poor Black youth from the south side of Chicago wasn't going to resonate with everybody at the table. Yeah. Not that they didn't want to support, but it's just not a common lived experience the same way as I might not be able to relate to a cricket player because cricket wasn't a big deal, coming up through high school. So I think it was me just kind of learning to listen to the room before I spoke, and then leveraging those opportunities that I got because I tell young people, all the time, my associate degree paid for my bachelor's degree. My bachelor's degree got me an opportunity where I landed at a hospital to pay for my master's degree. So I was able to make it through however many years it took me to get my master's degree, and I have zero student loan debt when a lot of critiques when I work with young people who otherwise are avoiding college is because they're worried about, wasting the money. So it's really just kind of simplifying the language to the audience that I'm working with. So there's one way in which I can speak to young people. There's one way in which I speak to leadership, and just recognizing that my role is just to be the bridge. And sometimes the difficult part about being a bridge is that people are going to walk on you, but that's my answer.
I mean, you need I call it being a translator.
There we go.
To a great extent too, yeah. Hey, we're really near the end of time. So what I would like to do is to go to each of the panelists and just any final thoughts, freestyle, whatever. And I will start with Dawud.
Yeah, this has really been an informative talk. Thank you all so much. I've definitely learned a lot. I'm excited for my rest of, high school through these various programs and, to start college and that in this whole new process. So thank you so much for having me.
Good luck. Good luck, man. I'm sure you're going to tear it up. Josh.
I also want to say thank you for having me. I actually have learned a lot about everything we just learned today. I want to help. I want to help more like you guys, and hopefully, I pass all my classes this year.
I believe me, I've been there. I've been where you were at. Kris.
No, just thank you, Matt and Tim. However, I got here, I think the wheels are not spinning on just how I can use my influence to expand opportunities. And I'm glad I had to get a chance to share today.
Okay, and Dr. Shuck.
Yes, I'll just say that, seeing Kris and Dawud, like they are why I do the work that I do. I'm so excited for their trajectories. And for those of you that have been impressed with those two, I hope that this inspires folks to do as much, even more. I mean, the sad reality is now because of the SCOTUS ruling from a couple of years ago, admissions of Black students in med school has gone down 11%. And so this is only going to continue to be more challenging. And so it's going to require all of us to come up with creative solutions, coming together, expanding opportunities to, curate these experiences for students like Dawud and Josh and others. So I hope this has invigorated folks to really do more. I mean, it's a tough job, but someone's got to do it. And I think all of us in this room have the skin, the will, and all of that to do that. And so I appreciate this opportunity to be able to speak about that.
Okay, well, from my perch, thank you all for being on this panel. Matt, thank you for asking me to be the moderator. I had a good time. We already see that there were some common themes that were starting to stick, and I saw that there was like a lot of movement and action in the chat area. So hopefully there will be a lot of follow-up. And with that, I will hand it back over to Matt.
Thank you, Levi. And thank you so much to our panelists for sharing all that. I think that was an incredible discussion. We really, really appreciate you sharing your lived experience, your expertise. And yeah, overall, my gears are turning around how we can, continue this work, build power with the organizations. You mentioned the grassroots nonprofits that are already doing this work. How can we build power with them to really drive these things home, continue the conversation, and continue moving into action, whether it's, through designing the programs that we do, whether it's influencing policy, so I really hope that we can walk away with all kind of a fresh perspective around the work that we can do together by coming together. So on that point, I will selfishly plug the next Youth Pathways Committee meeting. It's at the end of September, September 25th at 1 p.m. I'm going to put the date, time, and my email in the chat. Anyone that's on this call, feel free to reach out via email to either myself or anyone else that's offered their contact list in the chat. All of us are very willing to help with anything that may come up. So with that, I thank everyone. I'll pass it off. Johari, any final thoughts from you or the Rapid team?
Nope. Thank you, Matt, for really bringing this all together. Really nice to see everyone. This was a really great lunch and learn and very insightful. So thanks everyone for coming. Thanks for the support of Sprague as well, the Sprague Foundation.
Awesome. Thank you all. With that, we will adjourn. We appreciate your presence here. And like I said, let's continue the conversation and continue the work. Please reach out if you need anything. All right.
Thank you.
Nice one.
Thank you.
Have a good day. Have a great weekend.
Take care.